respected physical education teacher and my dear students. Myself Praveen Mishra, PGT physical education teacher, express thanks to give me the valuable session in my previous videos. Today's session of topic is Unit 7, Physiology and Injuries in Sports. Under this overview of session is physiological changes due to aging and the sports injuries and their classification in soft tissue injuries, abrasion, contusion, laceration, incision, sprain, strain, bone and joint injuries. Under this, dislocation, fracture, greenstick, comminuted, transverse, oblique and impact fractures. We'll discuss one by one. Now, physiological changes due to aging. In aging, our body start declinations or degeneration started at the age of 35, and physiological changes of our body started due to the age categories. Under this, the physiological changes are muscular strength, body compositions, pulmonary functions, endocrine changes, bone mass, cardiovascular functions and neurological functions that are affected to the physiological changes due to the aging process. We'll discuss one by one. Now first is muscular strength. The men and women usually the highest strength between the ages 20 to 40 years, and the muscles are cross-sectional area largest process are going on. According to the contraction of the strength, it will started on declinations slowly at the first and then are rapidly changed in the middle group of the age. Next is neural function. Neural function basically changes spinal cords. Total 40% declination can be started and 10% declination can be started in the nerve conduction velocity of the body, especially in the cumulative effects of the aging, especially on the CNS, central nervous systems functions of the brain. Third is endocrine changes. Endocrine changes basically started from the organ of the glands. It will be the quality of chemical changes. Chemical messengers are basically hormonal changes of the body, and targeted on the receptors organs can be declination. It will be started approximately 40% at the age of 65 and 75, approximately 50% degeneration can be started, and the older age of the 80% can be the glucose level tolerance and the type 2 diabetes should be started. Now pulmonary function, it will be started on the mechanical changes of the body, especially on the cardiac impact or the lungs can be declination can be started, degeneration, deterioration of the static and dynamic lung function can be measurables. Now next is cardiovascular functions, impact on the heart and the cardiovascular function and aerobic capacity also can be age-related factors should be affected. Lower down the maximum heart rate, maximum cardiac output means heart rate and the tidal volume can be affected on the body, especially the trained and untrained of the men and women also. Body composition, the fat percentage of the body should be declination should be started. Fat, body may bone, water, muscles and the human bodies should be declination started after the age of 60. The total body mass decreases, and despite the increasing of the body mass, fat percentage should be increases. Next is bone mass. Bone mass is a measurable amount of the minerals. Mostly the calcium and phosphorus should be declination can be started. Volume of bone can be declination. Osteoporosis means bone ki tendency should be decreased at the age of aging process. Especially among the post-menopause, especially on women can be decreased started. And the bone mass can be decreases by the 30% to 50% as the person of older age of the 60. Next is sports injuries. Sports injuries क्या है? In IOC manual of the sports injuries 2012, they are recommended that sports injuries can be defined as a damage of the tissues of the body. It can be occur as a result during the exercises or the sports competitions. Sports injuries can be defined as any type of stress, overstretch of the tissues, bone, ligaments during the fields and the resulting of their pain or hindering their performance, means performance को decline करता. It might be the cut, tear, overstretch of the tissues, breaking of the bones or declination of the joints are common injuries in the sports. We'll discuss one by one. Now classification of sports injuries, there are the direct injuries, indirect injuries, soft tissue injuries, hard injuries and overuse of injuries. Now direct injuries क्या है? They are the external forces causing the injuries at the point of the contractions. Indirect injuries क्या है? Usually involves the athletes or the players damage of the soft tissues such as ligaments, tendons or the muscles of the body through some internal or external forces. Soft tissue injuries के any injuries of the skins, muscles or ligaments are soft tissue injuries. Hard injuries क्या है? Hard injuries that occurs in the bones and the ligaments or cartilages. Overuse injuries क्या है? The continuous or repeatedly stress of the bones, muscles, cartilages and incorrect techniques or equipments to use in the training so that the overuse of the injuries can be occur. Now type of sports injuries, there are the 4 different type of injuries are there: skin injuries, soft tissue injuries, joint injuries and bone injuries. We'll discuss one by one. Now soft tissue injuries are abrasion, contusions, laceration, strain, sprain, incisions. These are the total 6 type of soft tissue injuries are there and we will discuss one by one. Now abrasion क्या है? Abrasion injuries are mostly common in moving on their contact. Sometime are the rough surface से ऊपर की layers हट जाना, causing by the gradings or rubbing away in the upper superficial air of epidermis. यानी epidermis means ऊपर की जो layers वो हट जाती है and reddish form में generations हो जाता है. What are the causes of this? There is rough surface में causing of the grading or rubbing away from the upper layer of epidermis. What are the treatments? फर्स्ट हमें इसको क्लीन करना है, इफेक्टेड पार्ट को, ब्लीडिंग्स को स्टॉप करना है एंड कंपैरिजन ऑफ बैंडेजेस एंड एंटी टेटनस इंजेक्शन शुड बी प्रोवाइडेड. नेक्स्ट इज कंट्यूशन. कंट्यूशन इट इज अ टाइप ऑफ हेमेटोमा, refers the collection of the blood vessels outside of the vessels. What are the causes? When the part of the body struck in any type of rough या any force crushes underlying of the fibers, muscle fibers and connective tissue without breaking the skin, then the continuation may be occur. It due to the below the collision of the player sometime or the pieces of any type of equipments or because of heavy fall. अगर आप गिर जाते हैं तब. What are the prevention? All the safety gear should be worn upon while playing in helmet. Or guard should be worn. What are the treatments? It is anti-inflammatory drugs should be used. Might be if you are heavy pain, ibuprofen or medication should be taken and prescribed by the doctors. Next is laceration. What is laceration? Laceration, it is irregular tears or wounds caused by the blunt trauma. What are the causes? Mostly the laceration result of the skin hitting and adjacent objects or objects hitting the skin with the forces. What are the prevention? The proper personal equipments including the eye protection can be helpful in the preventing the same. What are the treatment? Clean surface of the affected part, stop हमें bleeding करना है and earliest by the compression of the bandages हमें इसको use करना है. Next is the strain. Strain, it is injuries that the muscles or tendons are generally caused by the overuse of the forces or sometime overuse of the stretching. What are the causes? It occur in the suddenly acute strain or develop the slowly over time on the chronic strain. What are the causes? Lifting of heavy object, running, jumping, throwing are improperly, and prevention are regular stretching and strengthening of the exercises and can be prevented, measured for the strain. Now next is the treatment should be applying on the maintaining the strain muscles to be stretched of the position. Basically we will take that rest, ice compression and elevation. Total ice rest should be given to be the 48 hours. Ice should be used in the affected part. Compression means should be provided with the help of reducing the pain, and elevations should be the affected body parts. Next is sprain. Sprain, it is a stretching or tearing of that ligaments. There is a fibrous tissue that connected of the bones in the joints, and the common laceration of the sprain is over use of sometime in the ankle. What are the causes? It is overextended or tearing of the ligaments and several steering of the joints. What are the prevention? Prevention should be regular stretching, strengthening, exercise of any type of the sports, and preventive measures should be taken and kind of the sports injuries. What are the treatment? Rise should be taken, rest, ice, compression and elevation should be given. Next is incision. Incision is a cut and made in the tissue of the body and to be the exposed underlining of the tissues and tissues or bone and the organs. What are the causes? Should be caused of the clean and sharp edge of the object, such as knife, razor or the glasses or splinters. Prevention, the area should be free from the sharp edges, and treatments are gently washed an affected area with a soap and water to remove their dirty areas, and dry incisions with the clean fresh towel and before applying any type of dressing. Now heart type of injuries, there are two type of heart injuries are there, dislocation and fracture. Fractures, under this there are 6 type of fractures are there: stress fractures, greenstick fractures, comminuted fractures, transverse fractures, oblique fractures and impact fractures. Now first is dislocation. Dislocation, when the bones, articulation of joints, when the bones are one joints to be other joints are dislocated. What are the causes? That causes are the trauma forces to the joint. Out of the places, causes of dislocation, sometimes accidental fall, contract of sports such as the football. Example is football are common causes of the injuries. These are the injuries are mostly happen in older people and who have the weaker muscles or balance injuries. What are the symptoms of their severity and location of the injuries? Are pain होगा, swelling होगी, sometimes bruises होगा, instability of the joints होगी, losses of ability to the move of the joint होगा, visually deformed of the joints होंगे, bones like out of the places होंगे. Now what are the treatment should be taken by the dislocation? Treatment should be the severity of the injuries पहला. Second is the type of the joint should be कहाँ पर joints में dislocation हुआ है, and applying sometime ice and keeping the joints elevated हमें करना पड़ेगा due to the reduces the chances of pain. Medications हमें लेना है with the prescribed by the doctors and to reduce the pain of the dislocation. Manipulations हमें करना है, sometime rest. Once the rest of the joints back in the places, you can need to be the protected and keep should be immovable हमें रखना है. Sometimes using the sling or splint can help to be the area of heal fully. Rehabilitation process हमें करना है. The physical therapist exercises strengthening sometimes muscles and ligaments around the joint to help the support it, and surgery if it is a heavy and doctor can be recommended. Manipulation does not work to put the bones back in the place. The dislocation damage the blood vessels and the nerve also. The dislocation damage bones more. Tore muscles means toned muscles or ligaments that use can be repaired. Many example knee joints का दिया हुआ है. Next is fracture. Fracture क्या है? Breaking that bones. Fracture can caused by the direct impact and such can fall a severe of the tackles. Now the first type of fracture is stress fractures that can be occur in overuse and the failures to have adequate equipments to protect the body. यहाँ ankle fracture, stress fractures दिया हुआ. What are the causes? Resulting the increase the amount of intensity of activity too quickly. What are the prevention? Low impact activities that can added to exercise, regain to avoid repetitively stress a particular part of the body. What are the treatment? Rest, cold therapy, ice pack, cold compression, apply ice to injury areas, anti-inflammatory medication such as ibuprofen, aspirin, and recovery time of 6 to 8 weeks is required for a healing process. Now next is greenstick fractures. Basically greenstick fractures in a young soft bone are broken. What are the causes? The fracture commonly occur within the fall. अगर हम गिरते हैं तब होता है. What are the prevention? Regular exercises, ensuring the childs are safely providing in proper safety and equipment, and adequate calcium to be provided in a diet. What are the treatment? Removable splint splint resulting in better outcomes, and that causing in a children with the dorsal fractures of the distal radius and ulnar joints. Now next is comminuted fractures. This type of fracture broken, splint or crushed into a number of pieces में टूटते हैं. What are the causes? Direct or indirect trauma or violence can be causes in comminuted fracture. Prevention should be maintaining strong bone by eating food that rich in a calcium. Regular exercise can be help in the prevention of this type of fracture. What are the treatment? First हमें X-ray करना है for diagnosis के लिए. And when the bone are broken in jammed fractures, mean एक दूसरे से ऊपर jammed fracture होते हैं. Sometimes surgical nails, wire plates, etc. It should be required in a communicated fractures. Next is transverse fracture, where the bones are broken in straight break right across to the bone. What are the causes? Large amount of the forces in transmitted directly and perpendicular to the bones. What are the prevention? Physical activity, weight bearing type of exercise, make the bones are stronger. The bones can be strengthened by eating food rich type of calcium and taking regular exercise. What are the treatments? Rest and medications. Back brushes means TCL or abdominal type of prescribed to reduce the pain, and limiting motions means हमें motions यानी movements को limited करना है while their fractures are occur. Next is oblique fractures. When the oblique fractures are broken in diagonally forms, diagonally break होते हैं. What are the causes? The bones as a result fall, accident or other type of trauma. Now prevention can be strengthening on the basis of eating food, rich calcium में intake करना है, and regular help of preventing their type of fractures. What are the treatments? Severity of cracks or broken, anti-inflammatory medications हमें provide करना है, and reducing their bones can be help in some time can be not to be extended. Now next is impact factors, where the impact factor the bones are jammed means ऊपर की bone नीचे की bone से struck हो जाती हैं, अंदर चली जाती हैं. What are the causes? Sometime of the height with the greater impact. What are the preventions? Increase their physical activities, weight bearing type of exercise, maintaining the good amount of calcium foods. What are the treatments? The fracture can be broken into the large fragments, so that treatment can be taken by the sling or splint can be required, and movements can be enhances means हमें movement should be आपको stop करना है, and essential provided their damage where the further damage cannot be taken. Now purely CBSE curriculum which I have taken 24-25, CBSE handbooks, the data which I was taken is easily available in the CBSE site.